Good day, class. In this video, we are going to study a new topic, the Chinese medicine formulae. This is a subject that focuses on prescriptions. One of the reasons that we use formulae instead of prescriptions is because that in Chinese medicine, not all prescriptions are considered as formulae. This is also one of the most typical characteristics in Chinese medicine, especially when comparing with conventional medicine. In a formula, there are a group of different medicine or herbs. In conventional medicine, it focuses on the efficacy of individual medication, although in one prescription, it is consisted of one or more than one medication, depending on individual conditions. No matter how many medications that have been prescribed in one prescription, doctors will focus on the indications of each medication. In Chinese medicine, we do focus on single herb. That's why we have to study the Chinese materia medica. However, apart from the indications of single herb, we more focus on the formulae, which means we have specific principles when selecting herbs. The Chinese medicine formulae is considered as a foundation subject of Chinese medicine study. However, this subject is also a bridge between the theories and the clinical practice. After studying the formulae, Chinese medicine students will continue to study the clinical subjects such as internal medicine, gynecology, pediatrics, etc. As we mentioned previously, this is a subject that focuses on how to construct a group of herbs in order to treat specific conditions or diseases. Since we are focusing on acupuncture, why we have to study the formulae? When treating a patient, how to select the acupoints in one patient? Could we select do 14 and run 6 together? Yes or no? What's the reason? What's the reason behind your selections? After studying the principles in Chinese medicine formulae, you will understand that the reason behind these groups of acupoints. So in these few videos, we are going to study through a few examples of formulae, and from these examples, hope you will understand the principles of constructing a prescription. The Chinese medicine formulae in Mandarin is named as Fang Ji Xue. Fang means rules or principles. Ji also similar to Qi, which means tidy, very tidy. So we use the principles or use the rules to make something look tidy, which means in this formulae or the prescription, we do not select the herbs randomly. We have to apply specific rules to make the formulae look tidy. So in this subject, we're going to study the relationship among different herbs, as well as the clinical applications. For example, the image is here. This is the ingredients of 四君子汤. Tang means decoction. 四君子, the direct translation, 4 gentlemen. This is a very famous decoction. 4 gentlemen decoction, or even they make into pills. There are 4 ingredients in this formula: 党参、茯苓、白术、甘草. What are the relationship among these ingredients? What are the ratio of these ingredients? Why you increase one of these ingredients? While you reduce the other one, what will the increasing and the reducing affect the function of this formula? So these are the information that we're going to study. Similarly, in acupuncture, when treating a patient, when we use one prescription, we put a group of the acupoints, points A, point B, point C, and D. Why we choose these 4 points? For point A, do you want to use the reinforcing method? But for point B, you want to use moxibustion. For point C, you want to use reducing methods. Why you want to choose in this way? Why in one prescription you want to apply different methods on these points? That will help you to the Chinese medicine formulae. We help you to construct this formula, this prescription. No matter the Chinese medicine, conventional medicine, or pharmaceutical companies, they try to find the active ingredients from traditional medicine. That's what Dr. Tu Youyou works on. They try to find active ingredients from specific herbs or specific formula and try to purify the ingredients and then become a drug. That's where ethymethylene comes from. We have introduced the story of Dr. Tu Youyou, who was awarded the Nobel Prize in 2015. This is one pathway of studying the Chinese herbal medicine. However, this is not the only way, and also this is not the best way. We have another example. As we introduced previously, normally how we prepare the herbal medicine, we use a group of herbs, either the leaves, the flowers, the branches. We use a group of herbs, that's the formula. We put in the pot, we're going to cook the herbs. We're going to keep boiling for 10 to 15 minutes or even longer, depends on the ingestion. Then we fill out the liquids. We're going to drink the herbal medicine in this form, the decoction. This is the most traditional and most widely applied dosage form even today. In today's practice, we still use this kind of methods to prepare the herbal medicine. However, in some studies, especially someone they want to modernize the Chinese medicine, because as you can see, this process is inconvenient. Firstly, it is inconvenient. You need to cook. It takes time. Also, the taste of this herbal medicine, some of them taste good, but many of them doesn't taste good. So the modern kids, we don't like the herbal medicine because of the taste. So people try to modernize. They try to make the herbs into pills, into capsules. There's one experiment have been done in 1980s when the Chinese pharmacopoeia was written. They tried to modernize 连翘解毒丸. This is a pill this is a formula in Chinese medicine can clear the heat. Two of the most important ingredients, 金芥, 连翘. 连翘 is a flower, 金芥. These two have the essential oil. They have been proved that the essential oil in these two ingredients are very important for this pill. 连翘解毒丸, this formula includes more than two ingredients, but these two ingredients of 金芥 and 连翘 were considered as the most active ingredients. The essential oil from these two herbs are also important. So they purifies the essential oil there, and then they extracted the essential oil. they use different quality of the 荆芥 and 连翘. They have lower essential oil, medium essential oil, and a high dose of the essential oil from 荆芥 and 连翘. And then they mix with the other ingredients to prepare the pearls. The result shows that there are no significant differences among the low dose of essential oil, medium dose, or the high dose. There's no significant difference, and also the efficacy of these pearls doesn't work that well. However, in the same experiments, they use the 荆芥 and 连翘. The one had been removed the essential oil. So they prepare the 荆芥, they use this as the material, and then they take the essential oil out. They use the 连翘. They remove the essential oil because they want to use the active ingredients. And then the rest of the ingredients, the rest of the herbs, they use the rest of the herbs, which means there are no essential oil. They use the herbs to prepare the pearls. They found a better result than the essential with the different doses of the essential oil. From this example, you will see that the reason why we still keep the original method to prepare the herbal medicine, because the active ingredients or the so-called active ingredients of single herb doesn't change the function of the formula, doesn't improve the function of the formula, rather the whole plants. Another reason because we don't really know which one is active, although we know that the essential oil from these two are very important. But how about other ingredients? We have no idea. So this is still one of the most important process of preparing herbal medicine. Although we try to modernize the herbal medicine, extracting the active ingredient is not a good way, or at least it is not a good way at this stage, at present medical level, or the chemistry technique. Because we are not going to focus on the Chinese herbal medicine, our program is focused on acupuncture. In future, you're going to be trained as acupuncturist. So in this subject, we only give you the general introduction, we give you a general background of the formulae, the principles of the formulae, and we're going to introduce some formulae to help you to understand further how to construct a formulae. And then in this process, I hope that you can, in future, you can apply the thinking how to construct the acupoints in the same way of how to construct the herbs in one prescription. When we study the formulae, we have to clarify that in Chinese medicine, the formulae neither focus on the diseases nor the symptoms or specific symptoms. The formulae focus on the symptoms. That's why in the diagnostics, we focus on the symptom differentiation. No matter which symptom differentiation method you're going to use, these are symptoms. We focus on a group of symptoms, not one specific symptom. So the treatment from the formulae will focus on the symptom. Similar to the other subjects, at the beginning of each subject, we're going to discuss the origin and the development of that subject. From the discussion, we will understand that the development of formulae is not achieved in one day. As you can see the example on the right side, this is an example of the formula. When treating this patient, I use 9 ingredients from the 9 ingredients of the herbs. In this formula, this is a formula from the medical books, from the Asian medical books. But how does this formula come from? In Shang and Zhou dynastics, which were about 3,000 years ago, 3 to 2,000 years ago. When we study the history of Chinese medicine, we understand that in Shang and Zhou dynasty, we don't really have a lot of proof or evidence in medical. Especially we don't have a lot of monograph on medical, especially in Shang dynasty, about 3,000 years ago. In these dynastics, although we don't have the records of the Chinese medicine, but we have the literature records. So from the literature books, we can see some stories that they describe about the medicine. For example, in Zhou dynasty, there's one book we have introduced previously, Li Ji. So when we study the history, I said that the Li Ji, Li is etiquette. So it describes the rules of the dynasty, of the Zhou dynasty. In this book, it describes that they use one word. They says if the emperor is sick, the minister have to drink the herbs. If the emperor is sick, the minister officers have to drink the herbs, have to test the herbs for the emperor. In one family, if the father is sick, the son has to drink the herbal medicine for the father. So that's a very old rule in the Chinese society that was about 3,000 years ago. From this description, although we don't follow this rules anymore, but from this description, especially when the character they use the character of in. So they use this character. This character is pronounced as in. It means drink. You drink the herbal medicine. When you use the term drink, which means this herbal medicine was in a liquid form, that's how you can drink instead of eating the herbs. From this discussion, we understand that at last stage, the herbal medicine already develops into a decoction form. Instead of using the raw herbs, you're going to chew the raw herbs, the raw plants. You're going to decoct the herbs. You're going to cook the different ingredients, and then you drink the herbal medicine. So that's the development in the Shang and Zhou dynasty. This is also benefits from the use of fire. So at this stage, people know how to use fire. We add the raw food, from the raw food to cooked food. That's something in the history. That's the development of the human or of the civilization, from raw food to cooked food, the use of fire. And then from this discussion, we also understand that we don't really use single herb. We use a group of herbs. That's why we need to cook them. Instead of using one single herb, we use a group of herbs. In future, we will explain why we have to use a group of herbs, why we need to use 9 different ingredients instead of one ingredient. What's the benefits? What's the advantage of using a group of herbs? The advantage of using a formula instead of a single herb. So in future, we're going to explain. There's another story that describes in this period. That's the story of the Xue. We also have introduced the famous daughter of Bian Xue. If you still remember in the history, Bian Xue, he was one of the most famous figure in Chinese medicine history. The literature describes how he studied the Chinese medicine because he respected one old man, Tang Sangjun, because he respected the man, and then the old man gave Bian Xue a secret formula as a gift. In this book, in this story, it mentions the secret formulae directly, which means at least in this stage, people know about the formulae. People knows about the group of herbs. So these are some other proof that's from these dynastics, from some stories, from some literature works that we know the Chinese medicine has developed from single herb to a group of herbs. That's why in Chang Sangjun gave Bian Xue a secret formulae, a book of the formulae. In the next stage, early Qin or pre-Qin dynasty, this dynasty actually about a little bit earlier than 221 BC. So the Qin dynasty was from 221 BC to 207 BC. When we say the pre-Qin dynasty, pre-Qin means the earlier than Qin. So we actually talking about 400 BC, 400 BC to 207 BC. During this period, pre-Qin dynasty or early Qin dynasty, these periods are when the classic appears, such as the Huangdi Neijing. The Huangdi Neijing were written between 475 BC to 220 BC. So in these books, these Chinese medicine works that we still can see today, we can see the formulae. You can see some ingredients in one formula, in some ingredients in one formula. So in these books, they don't recommend to use one single herb itself. One single herb, they use a group of herbs. So these books we can see today. And later on in Han Dynasty, we have the famous books of Sanghan Zabing Lun. Sanghan Zabing Lun is also one of the classic. From Huangdi Neijing, we got 13 formulae. In Sanghan Zabing Lun, we got 314 formulae. And later on, we still have the monograph on formula, such as 备给千金药方, 千金一方 from Dr. Sun Simiao. So if you are not familiar with these names that I mentioned, you can go back to the history. We have introduced all these doctors. Sun Simiao, he compiled the formula books in Sui and Tang dynastics, and also in Sui and Tang dynastics. In the books that Dr. Sun Simiao compiled, you can see some herbal medicine, some formulas, the title of these formulas. So in Chinese medicine, the formulae we use, especially the famous formulae, the formulae we use, we got different titles, such as the Four Gentlemen, we got 四物 decoction, we got Six Gentlemen decoction. So most of the decoctions, the formulae, we have specific title. From the specific title, some of them we can identify where they will come from. For example, in Sui and Tang dynasty, that was about 1,500 years to 1,000 years ago. In the books of Sun Simiao, you can see many titles. They actually were from India because they kept the pronunciation of the old Indian pronunciation. So we will see that some herbal medicine and some formulae introduced from foreign countries to China, and then the Chinese medicine absorb the theory from those medicine and into Chinese medicine. From this process, you will understand the communications between foreign countries and China. This we also have discussed in the history of Chinese medicine. And as the time develops, we got different doctors that specialize in some specialities. So there are also some monographs, some formulae specific focus on some specialities. After the Song dynasty, 960 AD, you can see more formulae books today. There are more books we still can see today. One of the reasons is because these age dates are closer to now, about 1,000 years. Another reason is because in Song dynasty, the technique of printing has been invented in China. So the medical books were printed instead of copying by hand. When we use the technique of printing, we can have more books. That's why until today, we still can see a lot of books from Song dynasty, Song dynasty, Yuan dynasty, Ming dynasty, Qing dynasty. These 1,000 years, there were a lot of developments in Chinese medicine. Many schools, even theoretical schools, have developed, such as the Tonify, the Yin school, the Tonifying Spleen school, and all these different schools, they have some specific formula that focus on the tonifying spleen or tonifying yin, and the ingredients. Sometimes they add some ingredients, sometimes they reduce some ingredients. These reducing or adding ingredients are not randomly added or reduced. We have to follow specific rules how to conject the prescription. And also, along with the development of the formulae, these books that focus on the formulae has developed from the purely description, such as they keep the records of the ingredients of the herbs, and then they develop into the explanation using the theory from 黄帝内经 and other theoretical theories. These were the important developments in formulae. Because as you can see from this process, the formulae actually have developed from the experience of using using herb A treat one disease or one symptom or even one syndrome, to herb B treating the other syndrome, or the group of A and B to treat the syndrome. But what's the reason behind the application? These are still also the developments of the formulae, especially in the recent 1,000 years from Song dynasty. Practitioners try to use the theory from 黄帝内经 伤寒杂病论, the other theory in Chinese medicine, to explain the formulae. So this is a very important development of the formulae. Until today, the application of formulae, the study of formulae, we still use these theories. 52病方, this is one of the earliest formulae book. Fang is the formulae. 病 diseases. 52. So in this book, it describes 52 formulae it describes the formulae for 52 diseases. This was unearthed quite early in Hantung. 黄帝内经, one of the classic. There were 13 formulae described in this book. Modernization was written in 475 BC to 200 BC. So about these 200 years. Among these 13 formulae, there were decoctions, pearls, powder, ointments, and wine, etc. So as you can see from the examples here, we got many different dosage forms. 伤寒杂病论 about 200 years later, in 220 BC AD, Dr. Zhang Zongjing recorded 314 formulae. So 后备急方 there were more formulae there for the emergency. So if you still remember where the artemisinin comes from. When you see the 13 formulae, some students will ask, since you said that the development of formula has developed from 3,000 years ago, from Zhou and Shang dynastics, but why after 1,000 years, 475 BC, in 黄帝内经, more than 1,000 years. So this is 1,600 BC. Okay, I'm going to put in here. On Shang and Zhou dynasty, 1,000 BC. The formulae were developed has been developed since there. But after 1,000 years development, why we only have 13 formulae in the classic? You feel confused why we have only 13 formulae in the classic after 1,000 years. One of the reasons is because 黄帝内经 is a book that talk about the theories. So in the past, the books talk about the formulae, fang, and theories were separated in two different books. So at that stage, we got 7 theoretical books. We got 11 formulae books. So as described in the history, we actually have more formulae books at that period. Although most of these books we don't have now, we still have the title, but we could not see the books because they were lost. But we still can see the title, even from 伤寒杂病论. We can see the titles of the theoretical books and the formulae books. The 7 theoretical books, today we only have 1, 黄帝内经. We lost the other 6 books. For the formulae books, we don't have any. But we have some of the contents, they were kept in 黄帝内经, in 伤寒杂病论. So from these records, we knew that the development of the formulae. In Tang Dynasty, Dr. Sun Simiao, we mentioned just now, 备集千金药方, 千金医方. We recorded more than 5,000 formulae, more than 2,900 formulae in this book. 外台秘药 in a similar age, more than 600,000 formulae. 太平盛会方, that's in Song Dynasty, more than 16,000 formulae. 圣济总录, 20,000 formulae. And today, we have 中医方剂大辞典. So this was the dictionary that we are using now. Dictionary of Traditional Chinese Medicine Formulae. We recorded 96,592 formulae. As you can see from these records, I trust that all of us will agree that no one can remember 96,592 formulae. No one can remember in your brain with 96,000. So from our study, what we need to do, we need to study the principles of how to construct the formulae. And then you can apply in the practice. You can use these dictionaries as a references. So here, just the brief development of the formulae. In this video, we have studied the difference between the formulae and the prescriptions. We also have clarified the reason why we keep the words formulae instead of the prescriptions. We also have studied the brief development of the formulae. In the next video, we are going to study the specific content of the formulae, especially the principles. Thank you for your attention.